All right. Ready to dive into something interesting? We're talking circumferential abdominoplasty today, and it's a bit more than just your average tummy tuck.
It is.
We're lucky enough to be working with healr.co.in's material today,
Yeah.
and they're doing some pretty cool stuff with this procedure over in Mumbai.
Mumbai, yeah.
So if you're curious about, this kind of body contouring or, hey, even just medical tourism in general, this one's for you. Let's go.
It's interesting because a lot of people, when they think tummy tuck, they think just the front, right?
Right.
This is like it's a 360.
360.
The whole way around.
Yeah.
So you can imagine someone who's had, a pretty significant weight change.
Yeah.
They could have excess skin all the way around.
Yeah.
And that's really going to affect, not just how they look, but how they feel about themselves.
It's going to be uncomfortable, too. It's not just about appearances, right? I mean, to feel good in your own skin after a big change like that.
And that's where this comes in. It's getting that contoured, balanced look, but it's also r.to.in even mentions hygiene.
Oh, wow.
Which you wouldn't think of right away.
No.
But when you think about it, if you've got, excess skin folds and things, it can get irritated, it can trap moisture.
Mm-hmm.
So this is kind of addressing those things too. Comfort, well-being, the whole package.
That's a really good point. I would not have thought of that connection right away, but it makes total sense. Now, this sounds like, if we're talking big weight loss, maybe someone's had bariatric surgery or something, or even just a huge lifestyle change.
Yeah, and they are big on the stable thing.
Stable.
Yeah, like you've got to be at this weight for at least 6 months. They want to make sure that it's going to last.
Yeah.
Your body's had time to kind of get used to this new you.
So it's a commitment. It's not just like
Not a quick fix. No.
Not a quick fix, yeah. Okay.
Yeah.
So you've done that. You're ready. You're stable. You're committed. What does this actually look like? What is the procedure?
Well, there's a whole assessment thing, right? Make sure you're a good candidate. But then you're talking about this is surgery. So
Okay.
4 to 7 hours. General anesthesia.
4 to 7. That's a long time.
It's not messing around.
What's happening in that time? Break it down for me.
So basically they're making an incision, but it's a circular incision around like the whole midsection. And they're removing the excess skin, the fat. They're also tightening the abdominal muscles. Because if you think about it, those could have gotten stretched out over time.
Right. From the weight gain and everything.
Exactly. And sometimes they even reposition the navel
Really?
to make it all look,
Aesthetically.
pleasing.
Wow. So they're really like reconstructing your core.
Pretty much.
Hmm.
Like I said, it's a 360. Not just looks either. Functionality too.
Yeah.
They're putting you back together, basically.
Wow. That sounds intense, but amazing.
It is. And that's why this whole thing about having a qualified, experienced surgeon, healr.co.in really stresses that.
Makes sense.
It matters.
Yeah. It's a lot, Like you said, 4 to 7 hours, that's serious stuff.
Oh, yeah. And we haven't even touched on recovery.
Because I imagine that's not a walk in the park either, right?
No, you're not bouncing back from this overnight. You're looking at, like, those first few weeks, especially limited mobility, compression garments. They even talk about drains.
Drains? Like, what do you mean?
So apparently it's pretty common to get fluid buildup under the skin after a procedure like this.
Makes sense.
So the drains help with that. It prevents complications, helps you heal properly, all that good stuff.
It's wild, isn't it? Like, you think about the surgery and it's all about how it looks, but there's so much going on under the surface.
Totally.
Yeah.
And it all takes time. Like, to really see the final results,
Yeah.
we're talking months. Could even be a year for the swelling to totally go down, for scars to fade.
It's a reminder that nothing happens overnight. Okay, so we've talked about the procedure itself, but let's zoom in on healr.co.in for a sec. I mean, what makes them different? Aside from being in Mumbai, of course.
Well, they really emphasize their surgeon's expertise.
Right. Which makes sense. We just talked about how important that is.
Exactly. Yeah. So, these aren't just any doctors. We're talking highly trained, board certified. They've got the experience, specifically with this procedure.
So that's one thing. What else?
Facilities. State of the art, they call it.
So fancy equipment, all that.
That, but also just the whole environment. They're all about being safe, sterile, making sure you can heal properly.
Peace of mind, basically, knowing you're in good hands.
Exactly. And they're big on the whole comprehensive care thing.
What's that mean?
So it's not just about the surgery itself. They're there for you before, with the consultations and prep, and then afterward too, aftercare, follow-ups, the whole 9 yards.
Okay, so they're with you the whole way.
The whole way. They get that this is a big deal, It's not just physical. There's an emotional, psychological side to it, too. They want you to feel supported.
I like that. Okay, but let's be real for a sec. We're talking medical tourism. People are probably wondering about cost.
Oh, for sure. Cost is always a factor.
Right.
Especially when you're going to another country for something.
So how does it work with them?
Well, it's going to depend on a lot of things, right?
Yeah.
The surgeon, the facility, anesthesia, and even the length of your stay, how long you're there. They have different packages too, so that can change things.
Okay, so there's no one answer.
Right. Best thing is to talk to them, be upfront about what you're looking for, and get a personalized quote.
Transparency is key.
100%. And remember, it's not just about finding the cheapest option. You have to think about the quality, the surgeon's experience, the safety of it all.
You're making an investment.
Exactly.
Speaking of which, let's talk about the not so fun stuff. Are there risks with this? There are always risks, right? I mean, it's surgery. You can't escape that completely.
No, you can't. And to their credit, they don't try to sugarcoat it.
That's good. So what kind of things are we talking about here?
Well, the usual suspects, for one. Infection, bleeding, how you react to the anesthesia. That's always a gamble, right?
Okay, so the general stuff. Anything specific to this procedure, though?
Let's see. They talk about seroma. That's like when fluid builds up under the skin.
Oh, okay.
Usually not a huge deal. They can treat it, but still something to keep in mind. And then there's always a chance of asymmetry, right?
Like symmetry meaning?
Like both sides healing a little differently.
Yeah.
The final result not being perfectly symmetrical.
Ah, okay. I guess that's where the surgeon's skill comes in, huh?
Big time. You want someone who knows what they're doing to minimize that risk as much as possible.
Makes sense. What about scarring?
Yeah, that's the other big one. I mean, we're talking a circular incision here all the way around.
Right. So scars are unavoidable.
Pretty much. They say they use special techniques to make them less noticeable, and over time, they should fade. But, realistic expectations.
Right. You're going to have a reminder. It's just about how much of a reminder.
Exactly.
Now, they've got this whole FAQ section on their website. I was looking through it.
Yeah.
It's actually really helpful. A lot of the big questions are covered there.
Like what?
Well, the number one seems to be, am I even a good candidate for this? Which we touched on.
Right. It's not just about loose skin, like we said.
Right. You got to be healthy overall, have realistic goals, and be ready to keep up the work afterward.
It's a lifestyle shift, for sure.
Totally. They also get a lot of questions about the timeline.
Recovery.
Yeah, like, when can I go back to the gym? When can I wear a swimsuit? The important stuff.
The real life stuff, yeah.
And it sounds like it varies, but the big thing is to listen to your doctor.
Always good advice. Don't push it before you're ready.
For sure. Oh, and another one was, how long do the results last?
Because nobody wants to go through all that for nothing.
Right, exactly. But it sounds promising, especially if you're taking care of yourself, diet, exercise, all that.
Got to maintain, right?
It's an investment. Treat it that way.
100%.
Well, I think we've covered just about everything today. We've talked about what this procedure actually the whole shebang, the good, the bad, and the stuff you just have to be prepared for.
The realities of it all.
Exactly. And I think what's really cool is that we're seeing more and more options like this popping up, even overseas.
It's a different world out there.
It is. But, and I think this is important, if you're considering something like going to Mumbai for this, do your homework.
Oh, absolutely.
Research, talk to people, ask questions. Don't be afraid to be thorough,
It's your body, your decision. You got to own it.
Well said. It's been great diving into this with you.
Likewise.
And for anyone listening, hey, stay curious. We'll catch you on the next deep dive.